Good evening. My name is Donald Milan from Teagasc, the Agricultural Advisory Research and Education Authority. I am the Regional Manager for the Tipperary region, and I'm delighted to welcome you to the first in this year's Tell Me About series. We all know that 2020 has presented us all with many challenges, and not least was the unwelcome visitor to our lives of the COVID-19 virus. But we are delighted to collaborate with the Trinity College Dublin, Letterkenny IT and IT Carlow on this innovative project to highlight many of the health and wellness challenges that are facing rural communities as we face into the winter months in the midst of this global pandemic. I would like now to introduce you to Paul Horan, Assistant Professor in Intellectual Disability Nursing at the School of Nursing and Midwifery at Trinity College Dublin, who will explain a little more to you about the Tell Me About series.
Good evening, ladies and gentlemen. I greet you tonight as the Chairperson of the Civic Engagement Committee at the School of Nursing and Midwifery at Trinity College Dublin. We have been running the Tell Me About lecture series in college for a number of years now. But due to COVID-19, like everybody else, this year we can only interact through your computer screens, tablets or mobile phone screens. With the TV production magic of our colleagues in IT Carlow, we have created this year's programme, which will focus on rural health and wellness, featuring narratives from the lives of some well-known Irish people, blended with scientific contributions. In essence, it's a mixture of the heavy and light, akin to a COVID-19 trauma agus atrom. Our host for tonight's programme will be the National Director of Teagasc, Professor Gerry Boyle.
COVID-19 has presented us with a whole new array of words and statistics to describe the spread of the virus. Our next presentation is from Comiskey, Professor of Healthcare Modelling and Statistics at the School of Nursing and Midwifery at Trinity College Dublin. And Catherine will talk to us in an attempt to unpick this whole new language. Her presentation is entitled COVID-19 and Asymptomatic Cases, Learning from the Past and Planning for the Future.
Hello, my name is Professor Catherine Comiskey and I'm based at Trinity College Dublin in the School of Nursing and Midwifery. And I'd like to take this opportunity to thank Mr. Paul Horan and the public lecture series at Trinity College School of Nursing and Midwifery to inviting me to speak to you today about COVID-19 and asymptomatic cases and how we can learn from the past and plan from the future. So I am delighted to present this work to you today. I will tell you that it's also brand new work and that we have some of the very first results on asymptomatic cases available for you to see and hear about today. So thank you. So my name is Professor Catherine Comiskey. I'm a Professor in Healthcare Statistics and I work with a great team at Trinity College Dublin. I have interest in epidemiology, in infectious diseases, HIV and AIDS, people who use drugs, and I recently published a book called Addiction Debates, which is looking at all the hot topics from policy to practice in the addiction field, building originally from my work on HIV and AIDS. So today, in this lecture, I would like to go through a little bit about what is known about the current epidemiology of COVID-19 in Ireland. I would like to talk about the reproduction number and potential vaccination rates required. I'll show us how we can learn from past epidemics. And finally, we'll look at estimating the number of asymptomatic or hidden cases in Ireland, which are actually contributing to the silent spread of infection. And we're going to look at some of the best and worst case scenarios. And this is new results that have just emerged in the last week. So this is a familiar picture you will have seen. You will have seen what we've talked about as the incidence. The incidence with an epidemic is the number of new cases each day. And every day, we've all heard it on the 9 o'clock news, how the numbers are increasing every day. And in this graph, you can see the first wave of the epidemic, where we had very, very rising incidence up to a peak in mid-April. And then just looking at the details of those cases, we can see that our older populations, both rural and urban, have had a disproportionate amount of cases within their midst. So we see here that this is the danger with this disease, is that in actual fact, in the first wave of the epidemic, it affected higher rates of our older populations rather than our younger populations. And this graph shows that. And it's these vulnerable populations that we have to protect. We've also heard about the R number, so the reproductive number of the disease. It starts off being called the basic reproductive number, which is R0, and it's the number of secondary cases which one case would produce in a completely susceptible population. When we're looking at vaccination, the more appropriate number or metric is what we call the effective reproduction number. And this is the number that we hear reported in the news now, the effective reproduction number. This doesn't assume a completely susceptible population, because we have now the virus amongst our population. When the R number is over 1, an epidemic will spread. So each person will infect at least one other person. And we need to reduce that number below 1 so that the epidemic can die out. With other diseases, the way we do that is by vaccination. And we can look at the R number for other infections. So we can learn, as I said, from other infections. So with other infections, for example, measles, we have to vaccinate 94% to keep that R number down below 1. For mumps, it's 89%, 86% for rubella, that's German measles, and 80% for poliomyelitis. So what we can see from this is that it's easier, say, to eradicate polio than it is to eradicate measles. And that's why sometimes we have measles outbreaks in communities, because not every child has been vaccinated, and this R number goes up and we can see the infection rising in the community. But we do know from these past epidemics that if we keep the R number below 1, the epidemic will die out. Unfortunately, at the moment, with COVID-19, we do not have a vaccine. So we have to reduce the R number in other ways. We can also learn from HIV and AIDS epidemics. With the early stages of HIV and AIDS, a lot of people didn't know that they were HIV positive until they actually got AIDS. So we were able to say, well, how many have HIV? We're able to look at that and say, how many people actually have HIV and they don't know that they have it? Because with HIV, there's a very, very long incubation period. And quite often in the early stage of the epidemic, people only knew they had AIDS when they actually began to get sick. So looking at this, it's really not important in terms of this talk, the mathematics of it, but this is the sort of mathematics that we can use, that we can learn from other epidemics. So when we know the number of AIDS cases and we know the incubation period, we can work out the number of HIV cases those AIDS cases came from. And that's work that I did, a good number of years ago, out in DCU at the time with Heather Ruskin and Alistair Wood, two great mathematicians and statisticians, and work that I did more recently looking at hidden heroin epidemics with Dr. Orla Dempsey in Trinity College. So we can actually use our mathematics to find out or to estimate the number of hidden cases. And that's what I've been working on in Trinity in the last few months. So my aim is to work out the number of hidden asymptomatic COVID-19 cases, and also perhaps people who have been symptomatic who haven't been tested. So we're trying to estimate the hidden number of cases. To do that, we need to know the number of known cases and also the incubation period. So let's take a look first at the incubation period. So we have done in my team, in my group in Trinity College with Dr. Sonam Banka, who's a postdoctoral research fellow working with me, we've actually looked at the incubation period for COVID-19. So the incubation period is the time between exposure, actually getting the infection, and the onset of clinical symptoms. So I'll just say that again. The incubation period is the time between when you're exposed to infection and the onset of clinical symptoms. So you may have been exposed a number of days before you actually get symptoms. The problem is a person may become infectious, that is, able to transmit the infection to another person at any moment of the infection, and this moment will actually vary per disease. So we've taken a look at this incubation period and we've looked at it all over the world, myself and Dr. Banka. And we know from the HSE that the reported incubation period is an average 5 to 6 days. But it can be as long as 14 days before you show symptoms. And during that time, you could be infectious. So quarantine, they're saying, should be in place for 14 days from the last exposure to a confirmed case. But what if you don't know you've been exposed because the case may be asymptomatic or pre-symptomatic? So we took a look at, I think it was 64 studies across the world, myself and Sonam Banka, Dr. Banka, and 30 of those studies looked at the incubation period, gave us details on the mean incubation period, and the HSE is saying it's on average 5 to 6 days. But taking a look at those 30 studies, look at how the incubation period, these blue dots are the mean, but the little, if you like, whiskers around the dots, the line around the dots, are actually the what we call the confidence intervals. This is really how much it might actually be. So there is still great variation, as you can see, in the mean incubation period before you display symptoms. But you may be pre-symptomatic, or you may not have any symptoms, but you could be infectious. So that is why we should be quarantining 14 days at least from the last exposure to a confirmed case. But the challenge is we don't know necessarily that we have been exposed to a case, because if the case is asymptomatic or hasn't been confirmed. And this is the challenge. So working with our back calculation model that we learned how to work with when we were working with HIV and AIDS and numbers of people who use heroin, we can actually try and work back and say, from the known cases, how many hidden or unknown cases. So I'm working with another postdoctoral fellow of mine in my group, Dr. Anne Snell, and we're looking at, this is the first wave of the epidemic here on the right. This is how it increased and then it decreased, and this is the summer period where we had very few cases. So we're focusing on the first wave just for the moment. And this is the known daily cases to the 31st of July. Right up, and we can see how they have decreased. But we have been able to use the back calculation method with the incubation period, and we're being able to estimate the hidden cases. Looking at the known cases to the 31st of May, we could see, just by adding them up, that there were about 25,000 known cases. That was known through testing. Using the back calculation method, we have estimated there were an additional at least 25 or 26,000 hidden and unknown cases who have not been tested. And this, we believe, is actually the best case scenario. So we are saying, based on the back calculation method, we can say that for every known case, there is at least one unknown or hidden or asymptomatic case. So we may have double the number of cases that we know we have. So when we're out in the community, there are actually a lot more cases that haven't been tested, that maybe are asymptomatic or may indeed have symptoms but have not been tested. So there are at least double the number of cases. And that, in our estimation, is actually the best case scenario. We've also looked at what is known as the infection fatality ratio. And this is quite a difficult thing to estimate, so we're less confident with these results. Okay? So the infection fatality, out of all people infected, how many fatalities do we have? So this, because we are less is known about the infection fatality ratio, this we believe is the worst case scenario. Working with the infection fatality ratios of 0.5 to 1%, that's estimated across the EU, and working with the known cases up to the 31st of May, this was just looking at the peak, we have been able to estimate, we know there are 1,652 deaths, but we have been able to estimate using the infection fatality ratios that there may actually be 140 to 300,000 unknown cases. This is considerably worse than the previous case where we said there may be 25,000. This is what we call the worst case scenario. And in this case, for every known infection, there may be up to 5.5 to 12 unknown infections. And that is why it is so important to be isolating and social distancing within the community, because we do not know how many actual people have had this infection. But I can tell you today that it is at least twice as many than what we know we have, and it may indeed be 5 to 12 times as many in the worst case scenario. But all is not hope. I think if we look at the words of Michael Ryan, who I think we've all now come to know and love from the World Health Organization and admire, in his words he says, "I think it's important to put this on the table. This virus may never go away. It may just become another endemic virus in our communities. It may never go away. HIV, as we know, has not gone away. We've come to terms with the virus. We've found the therapies and we found the prevention methods. We haven't found the vaccine yet." I think similarly we can say the same for infections from measles, mumps to polio and winter flus. Before we had a vaccine, we learned how to live with and protect our younger and our older rural and urban communities. We recall before we had vaccination that when a child in the family had measles, the other children might have been kept home from school. They all got measles in their family home. If the child went into school, the others got the measles. If a child had if a person in the household had the winter vomiting bug, we kept them isolated. It's the same here. We reduce mixing. We abide by guidance. And we come through. Came through with HIV and AIDS, and we came through as a better world as a result of it. And I think what I find encouraging is that we can also recall that after the Black Death in world, in 1350s, came the beautiful period of the Renaissance. And that, to me, gives me great hope. Thank you very much.
I'm delighted to be joined this evening by Nicky Brennan, of course well known as former president of the GAA, but also he's been very actively involved in Age Action Kilkenny and Age Action Ireland. You're very welcome.
Thank you, Gerry. Delighted to be here.
I know you were a key player in driving the whole idea of an age action friendly community in Kilkenny. What does being an age friendly community actually mean in practical terms?
Well, I suppose in practical terms, it's our slogan in Kilkenny is for example, to make Kilkenny a great place in which to grow old. I mean, at its simplest, that's what it is, and that's really the vision for every age-friendly county in the country. And that's something we try to attain. Now, you do that through a multiple series of areas that we've worked with. The agencies who are involved in the whole age-friendly programme in Kilkenny were people like the local authority, people like the Gardaí, people like the HSC and its many connections, people like the sporting community, as I said, the Gardaí, people like that, they were all part of helping, and the business community, of course, trying to make the whole life of elderly people easier to live, now be that rural or be it urban, because when people get old, I mean, they have some frailties, and so many different parties then need to help them. The Gardaí in terms of safety, the HSE in terms of the various medical services that they would require. The business community needs to be more cognizant of older people as well, and how it should deal with older people when they come into their premises. So they're just some idea. And even when it comes to the whole leisure side, it's still important that older people have a need for leisure activities, and perhaps even more important that they have some way of enjoying that. They're just some examples of how the whole age-friendly programme, and older people then are part of groups that are influencing things like, for example, they're part of the local policing authority. They set about how the local authority should develop the streets and footpaths of, be it Kilkenny, be it the rural villages around the county. They have input into that, and they're recognised as a very important source of input into how these areas are now developed.
Of course, as they should be, and of course, in the context of living with COVID as we have been for the last 8 or 9 months, and heading into now another period of restrictions for the next 6 weeks, can you give us any practical examples of how communities could actually help elderly from your experience in Kilkenny?
Well, I think obviously COVID in particular, but even before COVID, rural communities in particular, it has changed a lot now. Rural Ireland has undergone huge changes. You and your colleagues in Teagasc would have seen that from the whole agricultural base, that the whole farming scene has changed a lot. But in rural Ireland now, difficulty at the one particular difficulty at the moment is access to church services. Going to mass is still very important for rural communities, urban communities, yes, as well, but rural communities. The post office is closed locally. They now depend on the man coming in the van, who is fantastic. We'll chat to them, but now that level of interaction is not quite what it used to be. The local pub is no longer open, and in many of them rural pubs have closed if they'd like to go down for a pint. The local agricultural branch is probably not now as active as it used to be, because a lot of the transactions are online. It's more difficult to walk the roads now because of cars on the roads. So the rural older person is finding it very difficult in their environment at the moment. And of course then they have to grapple with the whole area of their personal security. They worry that somebody is coming in and taking going to rob them and things like that. So they lock down early in the evening, and that whole type of life, certainly it's the mental anguish that causes is certainly immense.
And how can the rest of the community help the elderly who find themselves in, cocooning as they have been for the last while, and again heading into another period? How can the rest of the community help the elderly in practical ways?
I think that's a very good question, Gerry. I think a couple of things here is that, first of all, the local policeman is still very important. The local guard, the community alert, they're very important elements of safety. Then during the whole COVID time, but not exclusively during COVID, where older people had to stay at home, were confined to their house, local groups, particularly led by the GA, it must be said, but not exclusively, they got involved in delivering groceries, delivering messages, delivering medicines and various other things, and that helped enormously to support elderly people in their community. And they kept an eye out on people as well. They were seeing how Johnny down the road or Mary up the Boreen, how they were, and they were keeping an eye on them, because some of those people may not have family living locally. They may be living they may be in a foreign land someplace, and that made it more difficult. Equally, older people like that are not maybe overly adept at technology. The notions of saying to them, look, could you talk to somebody on FaceTime or talk to them on Zoom, doesn't mean anything to them. Perhaps there's not even broadband in the area. So there are many challenges there. So that's why local communities and rural communities especially were fantastic during the first part of COVID there when the lockdown was taking place. And that will now be very much needed during the 6 weeks that's upon us.
And it seems to me as well, Nicky, that it's very important that if we are assisting the elderly in our community, we respect their dignity and their need for independence and so on, and we don't just jump in, if you like, with offers of assistance. We do it sensitively.
And I think you're right there. There are some people that you will know that will happily take the help that's offered, because there's somebody that's in the community, they're out and about, they're maybe used to be involved in sport, or they might be in the ICA, whatever it might have been, but others maybe are more private and they may be reluctant to ask, so that has to be handled in a sensitive way. And perhaps going through your local priest might be useful, going through your local doctor, if there's not family members around, and explain to the individual that there are people out there more than willing to help. They're not going to intrude on your life, but you're happy to be able to do that. But an important development, Gerry, that I would like to mention is the Alone organisation, the organisation that was founded by Willie Birmingham in Dublin many years ago. Now, in Kilkenny, Alone has taken on the work of what was previously called the Carlow Kilkenny Contact Centre, which was helping older people with care and repair services and many other services as well. It's now has its own befriending service. That's also working in Donegal and a number of other areas. But this is where volunteers have been trained to be able to engage with older people on the phone. This is with the permission of their family, of course. Engage with older people on the phone, have a conversation with them periodically, maybe once a week, twice a week, or once a month, whatever the family thinks would be appropriate. Check in on, see how they're doing, have they taken their medication, have they got their groceries, do they need any help? And that's recorded on a system so that the next person who calls, and this is all done by volunteers, but it means the family then can be notified if the person who's calling them from the Alone office, who are well trained in how to deal with these matters and sensitive matters, they can tell the family that if they're happy or if there's a concern about somebody. But usually that person that's calling from the Alone office might very well be the only phone call that person will get in a day or in every couple of days. And that's why for many people, it's a lifeline to the outside world.
And I mean, what you're talking about there, Nicky, in terms of the difficulties that people face being isolated and alone, it predates COVID, of course. You know, it's part and parcel, particularly of rural Ireland, but also urban Ireland as well. But maybe in a funny sort of way, maybe COVID has given us an opportunity to be more proactive.
Oh, there's no question about that, but it also means that the whole issue of neighbourliness, which maybe we as a country had lost somewhat of, as the whole country developed and we came out of the whole Celtic Tiger era, maybe we became more impersonal as individuals. I think maybe COVID has got us to realise that no matter who you are, you're actually depending on somebody, and I think that's what the important lesson.
The old spirit of the mehel.
Very much so. And hopefully that's something that we won't lose it when COVID goes away, please God, which will be sooner rather than later. Because older people do need help in some. They may be reluctant to talk about their health or whatever, but it is important that they're able to get to their doctor and they're not struggling because they haven't got transport. That there's people there to help them, and that the community works together to help in those sort of ways.
And of course, if you do reach out to an elderly person, I mean, they have a fantastic store of knowledge about their community. You know, it'll be a mutually beneficial relationship for someone that does reach out like that.
Well, I think certainly one of the great things that I've often been, when I'm speaking in second level schools, it's something I say, this is obviously non-COVID times. I mean, you say to younger people, you know, do engage with older people because they will tell you about how things were in Ireland in years gone by, and maybe technology has passed out all of those, but it's no harm. I see when my own children were a bit younger and they saw when RT had the playback thing that they have on looking back
down through the years
and all that, and they see Ireland in the past and they see how people lived in those times. I think it is important for people to understand that older people had things very bad, very tough. Young people might think they have it tough in this day and age, and they have, to be very fair to them. But older people had it tough as well, and it is important to learn that. So the whole interaction between the generations, I think, is hugely important.
And mentioning COVID, Nicky, you yourself, of course, are a survivor of COVID.
Yeah, that's certainly.
Do you mind telling us a little bit about that experience?
Well, it's about 6 months ago, Gerry, at this stage, and my wife Mairead got it first. A bad kind of flu was the best way I could describe it, but she got it for a couple of days. And then it hit me just before Easter Sunday. It was the day before Holy Thursday, actually. And God, it knocked me like a ton of bricks now. I was very ill. One consolation was I had no breathing problems because I do an awful lot of swimming, and it was subsequently told to me by the medical people that was a big help. But I had coughing was terrible, and I was extremely ill now, and I was very worried for a while. So I did end up going, I had my test obviously, ironically driving into Nolan Park, having the test, knowing all the times I was in there as a player, as an administrator, and all the good times and mainly good times we had there as well. And you're driving in there and getting the test and realising that Clearly, I suspected I had it. There's no question about that. But going into hospital and getting tested for a half a day, thankfully not having to stay in there because they reckoned I was strong enough to come out of it. But it was a worry. And sadly, the day I was in there as well was the day there was a memorial service for 2 of the staff that had died in St. Luke's as a result of it, God rest them. And I knew one of them very well. And that was emotional, I have to say, that day, and it was traumatic, and I wouldn't wish it on anybody. So I suppose from my perspective, I'm grateful to have come through with it very, very well. I'm conscious of all the people who have had very great difficulties and have lost loved ones, but it's something we have to be very conscious of. It is a terrible disease, and certainly people just need to be careful and listen to the medical advice we're being given.
And the other point is, of course, we have a fantastic medical service, though. You know, I mean, I know it's under pressure, but the people involved are fantastic.
Well, I totally agree with you there, and I would have seen that at first hand, Gerry, through the Kilkenny Age Friendly programme, because we worked a lot with the HSE and with the various service providers in both Carlow and Kilkenny. I was involved on committees with them. We carried out, for example, we carried out surveys with St. Luke's Hospital. St. Luke's Hospital, by the way, was the first age-friendly hospital in Ireland. And we'd done that through what was called a walkability study with a lot of people looking at how patients should be handled in the hospital when they came in there, or people who were coming in for attention. And in fairness to the HSE, they came down and they listened, and they themselves took on a big survey, how we can make a hospital environment better for somebody who is going in there, who is clearly very sick, but their family are coming in and worried. And be you an urban person or a rural person, it is the same. Going into hospital is generally not a good experience, and it's a worrying time. So you want to make the whole experience as pleasant for the family and for the patient as possible. And to be fair to the HSE, I couldn't talk highly enough about them. They were fantastic, the way they embraced new ways of doing this. And they also worked with us on a dementia programme that was conducted by, led by Deborah O'Neill, and was funded by Atlantic Philanthropies, which looked at the whole area of keeping people, older people who are in the onset of dementia, how long can we keep them at home for as long as possible, and what do we need to do to support the families to keep their loved ones at home as long as possible. And again, the HSE were excellent coming forward with looking at their own practices in this area, how they might change. And I know that the report ultimately informed a lot of the ways the HSE address these matters, and for that I could not speak more. They were fantastic.
No, I absolutely agree. I think we've all experienced that in one way or another in recent times particularly. I can't let this sequence end, Nicky, without asking you to maybe comment on the importance of sport for rural communities at the present time.
Well, I'd probably start this by telling a small little story that's worth, the listener would probably like it, because during my time as president, we got a phone call from former President Mary McAleese into Croke Park one day. She said she wanted to meet Pádraig Duffy and myself. Pádraig was the Director General. Anyway, we popped out, and we would have known herself and Martin because she's a fanatic and Martin is on the GA. We went out to meet them anyway, and she said to us, lads, when I go around the country to meetings, all I'm seeing is women. I don't see many men there, and particularly older men. We need to do something to get men out. So we worked with Mary and Martin, and we set up a pilot scheme in 4 counties, in Wexford, in Kerry, in Fermanagh and Mayo. And they set up a group there, setting up activities for older men. That could be bringing in a former great GA player and talking to them about his life and times and discussing it with them. It could be bringing them to a match. It could be doing, so it could be a social evening and things like that. But I said to her then, I said, look, you know what we'll do? We'll bring them all to Croke Park. So we brought about 120 or 30 of them came to Croke Park one day, and we lined up Mícheál Mura Hertig to meet them and to talk to them and reminisce about it, and they were just fantastic. Now, rather ironically, out on the pitch at that very same time, the Irish rugby team were training. It was the time of the Croke Park being opened. Right, so they saw another dimension to the GA. But the most amazing thing out of all that, Gerry, 5 or 6 of the people who came that day, it was their first time ever in Dublin. It was amazing. It was amazing. You would say, now that's about 10 years ago.
That is extraordinary.
But it was extraordinary. It was extraordinary. And it was emotional when you were told that and you were talking to them. And they knew they were, they had got into the new Croke Park. The vast majority of them have never been there. And to be there. And we knew how important it was to them. So it's a project that it's not going on still, but it was something that was, it was dear to my heart. And I know it was dear to President McAleese's heart too.
It showed how important the GAA is to people in all over the country, and you must be delighted that the championships are going to go ahead?
I am. I know it deserves caution because, I mean, while the club games went very well, there's no doubt about it that there was, we'll call it misbehaviour for want of a better way of putting it, post a number of matches recently, which certainly contributed to the growth in the COVID cases, no question about that. Inter-county will be different because it'll be well policed, there will not be crowds at games, and the whole programme of inter-county, the way they prepare, is much more rigid, and the procedures and the regulations from a COVID operation point of view are very strict. So it doesn't mean players won't get COVID, I'm not suggesting that, but clearly it's going to be well policed. The government, we know, were very anxious that the GA campus would continue because they saw the rest of the year. We were heading into a potential lockdown a number of weeks ago. It was going to be dark evenings. What would people be doing? Having sport on the television was going to be very important. And whether you're a urban dweller or a rural dweller, that was very important. And it would help pass away what was seen as the cold and the wet and the.
I mean, you're looking forward to the game, and that kills a few days of anticipation, and then post-game you can reflect on the performance and so on.
Well, that's exactly it, and that's why, and I know even listening to radio today, there's concerns about, you know, the sport being allowed to continue, but we must understand that the mental impact COVID is having on people is just frightening. And if something like sport and other activities that are on television can help to alleviate some of the tensions and some of the worries that people have, it won't be great.
It's fantastic, Nicky, to talk to such a passionate person about sport and about the importance of dealing with people in the community or elders who, you know, have done so much for the country. By way of conclusion, what would you like to say?
Well, I have a little something written. Well, I didn't write it here now, but I read this before, and I'd just like to conclude this because I think the way we should look at older people. I think it is important that, you know, there will be older people looking at this, but there will be younger people as well looking at this, and well done to Teagasc for this development. But I think it's important we think about older people in the context of what I'm going to read now.
Okay.
An old woman died alone in a nursing home. When the staff were clearing out her room, they found a letter in a drawer. It was addressed to the nurses and administrators in the nursing home, but it could have been intended for any of us. Each one of them read the letter, and every single one burst into tears. It read, "Dear carers, what do you see when you look at me? You see a frail old woman who isn't clever and whose habits are strange. You see someone staring blankly with dull eyes, an old woman who won't obey and who spits out her food, leaving you frustrated. Is that what you see? If this is so, then you need to look a bit closer, because this is not who I am. I am a little girl with a loving family. I am a young bride whose heart thumps because I'm about to make a vow I will keep my whole life. I am a mother of 2 beautiful children who love and see me, who love and need me. I am growing older and wiser. My children are growing up so quickly, but I know in my heart that they will never truly leave. I am a middle-aged woman. My children have left home and my husband and I are happy on our own again. I am a grandmother. For the first time in decades, I have babies on my lap. I could not be happier. I am a widow. A dark cloud hangs over me and I mourn the passing of my husband. When I think of the future, I feel lost. I have no one to care for me. My children have children of their own. I don't want to burden them. I am an old woman. Nature shows no mercy. I feel trapped in my own body. My strength and beauty are sapped. But despite this, deep down inside me, there is still that little girl living in the ruins. In my mind, I think about all the good times I've had and the bad times too. I accept that nothing lasts. So open your eyes and look closer. You are not looking at a frail old woman. You are looking at me. Everyone has a past full of sorrow and joy. Elderly people deserve our respect as much as anybody else, because remember, someday we'll be just like them.
Thanks, Nicky. That was lovely, and it's been a privilege talking to you.
Pleasure, Gerry.
To finish the programme tonight, we have a special musical surprise. We will close the programme with a video of the new single from one of Carlow's finest performers, Derek Ryan, with a song entitled Wherever You're Going. And wherever you're going, go safely and adhere to the COVID-19 regulations. So good night and stay safe.
Wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. Hey! Oh, I went out one evening just to find myself a dance. I didn't know the meaning of true love or sweet romance, till I saw her sway underneath the lights. Says she, where are you heading for? And that's when I replied, wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. She had fire in her eyes, the colour of her hair, a look I knew for all my life I'd follow anywhere. She whispered in my ear as the sun began to rise, swear to me, my darling, you'll never say goodbye. Wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. Wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. Hey! How quick the years can pass you by when you're having fun. No matter just how fast they fly, our love will keep us young. Whatever way the road may part, I know I'll never stray. I promise till the end, love, you'll always hear me say, wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. Wherever you're going, I'll go too, if that's alright with you. Wherever you're going, I'll go too, sure I wouldn't know what else to do. Wherever you're going, I'll go too, if that's alright